So when patients come in our office, they have no idea what's going to be happening. They have a cataract, for example, or they've had just coming in for a regular routine exam. They might find out they have dry eye or whatever it might be. They come in and they go, I've never had this many tests in my lifetime on my eyes. And the great thing is being in a suburban part of a major city is our patients are getting technology they've never ever seen before. And it's technology not just to do the technology. Technology is to be done to get them the right diagnosis and the right treatment options. It's great to have OPD3 and other great diagnostic technologies in our practice. Patients are seeing they're having so many tests, and OPD3 measures many points. We actually show them in 3 to 6 seconds how many diagnostic data points I can learn about their eyes. And then we do other tests too, back of the eye OCT of the macula. We might do IOL master scan for IOL calculations. Patients don't realize what it takes to get them to their best possible outcome or just to figure out what's wrong with them. And so they really appreciate and embrace that we actually do all the right testing or at least bring the testing to find the right answer for them.